Come in.
Hello, my name is Danielle Trevino. I'm a medical student at Hall Foster School of Medicine, and if it's okay with you today, I'll be conducting your lymph and spleen examination. Is that okay? Okay, the first thing I'm going to do is I'm going to do the lymph nodes around your face, which are 6 points, and how I'm going to do that is I'm going to use the pads of my 2 fingers and do circular motions, applying light pressure at first and then a deeper pressure, okay? The first place I'm going to do is the pre-auricular, which is in front of the ear. Now, the second place is the post-auricular. And then the third place is the occipital, so that's at the base of the skull. Is it okay if I place my hand on your forehead to get pressure? And I'm going to do the other side as well. Okay. And then the next place is the tonsillar, so that's at the angle of the jaw. And then the next place is the submandibular, so it's beneath the jaw. And then the last place is the submental, which is at the end of the chin. Okay. All right. The next area I'm going to do is the neck. So if I could have you turn to your right, I'm going to be palpating anteriorly to the sternocleidomastoid muscles. That's right here. And I'm starting at the top. And then now behind it, the posterior cervical. Okay. Do the other side as well. Turn for me. That is right here. Okay. Now, the next thing that I'm going to do is around your clavicle area. I'm going to do the supraclavicular lymph nodes. So that's on top of the clavicle. So I'm going to do above the shirt for this. And then now below the clavicle, the infraclavicular. Okay. Now the next thing I'm going to do is the axilla lymph nodes, and that requires me to get in deep at the apex of your armpit, and I'm going to use 3 fingers for this and do circular deep motions trying to get to the chest wall. Okay, so you could just relax your arm because that will help me in getting to it deeper. Okay, and then this one. And then lower it. Okay. All right. Now I'm going to do the trochlear. So you want to shake my hand. That. Then this pinky is going to go on the medial epicondyle, and then my 3 fingers will just fall at the brachialis. Okay. And then circular motion. And then again, pinky at the epicondyle, fingers will just fall. Okay. Now we're going to move on to the inguinal lymph nodes. So if I could have you lay down for me, I will be doing this exam above the pants to maintain the modesty of my SP. So the first one, there's 2 groups. The first one I'm going to do is the horizontal group, which is below the inguinal ligament. So that's probably approximately right here. And then the vertical is near the great saphenous vein. Okay, and now I'm going to do the other side. and then the vertical. Okay. Now I'm going to do the spleen examination. Again, to maintain the modesty of my SP, we're just going to be doing it above his shirt. So this will require me to reach over to your, I'm going to lift your body up. And this is just to, I'm trying to palpate the edge of your spleen. So I'm going to start here, take a deep breath in and out. Again. One more time. So there I'm trying to get the edge of his spleen while he's taking a deep breath in, trying to catch that edge. The next thing I'm going to do is Castell sign. So that is, I'm getting the anterior axillary line coming down it, finding the last intercostal space of his ribs, and I'm going to breathe out. Breathe out for me, and keep that. So it's tympanic, and now take a deep breath in and hold it. And it's the same tympanic, which is a normal reading. So that's all in completing the lymph and spleen examination. Thank you so much. Let me help you up.